So, Dr. Montero Lopez, what are some reasons someone would come in to see you?
So by and large, I see mostly people who've had either recent injuries to their hands, their elbows, their arms, things like that, or people who have been noticing that over time, even though they haven't had any injuries, either the sensation in their hands or their arms has changed, or they're starting to have an ache or a pain, changes in function that they feel like they're going to open like a door or open a jar, and they're having a lot of trouble doing it and they're not really sure why. It's really for anything that's kind of changed in your hand. You generally use your hands in a way that you don't really think about. You just kind of want to do something and then you do it. And you don't really see someone who is like me, like a hand surgeon, until you reach a point where you now have to actively think about how it is that you're using your hand, because it's just not working the way that it used to. And that could be for any host of reasons, because it's numb, it's tingly, it's in pain. But that is usually the thing that sends people to go see a hand specialist. Some people will, just show up for only for injuries, but it's also these longer term like changes that are also really important to get checked out, because if you deal with them sooner rather than later, you have a better likelihood of actually getting back to the level of function that you were at previously, as opposed to having to kind of learn to live with the level of function that you have now gotten to.
Got it. So, there's no age requirement to come see you.
Oh no, I've seen everything from children who have had recent injuries to people in their 20s who unexpectedly break their hand, doing, anything, riding their bike, they fall, they break their wrist, to older people who have been dealing with, changes and arthritic changes in their thumbs and now they can't grip things. People of all ages get carpal tunnel syndrome. Pregnant women very frequently. Tendonitis affects every age pretty much, especially in athletes who are younger. Um, so yeah, I mean, there's really not, it's not an age defining specialty. That's part of the reason I love it so much. It's just very broad. It helps a lot of people in a lot of very different ways.
Excellent. Thank you.